Vitamin D is incredibly important for our health, and maintaining adequate levels is associated with numerous health benefits. Our bodies produce this vitamin thanks to sunlight acting on the skin, similar to how plants use sunlight during photosynthesis to produce oxygen. Several factors influence the synthesis of vitamin D. Season. UVB is responsible for synthesizing vitamin D precursor, cholecalciferol, in your skin. In winter, synthesis significantly decreases due to the larger angle of sunlight, which reduces the amount of UVB reaching the Earth's surface. Additionally, in winter, the body is almost entirely covered with clothing, and shorter days further limit skin exposure to sunlight. Age. The older you are, the less 7-dehydrocholesterol, the precursor to vitamin D, your skin contains. Staying indoors. Most of us spend the majority of our time indoors, especially between 12 p.m. to 3 p.m., when vitamin D synthesis is most effective. Remember, glass blocks UVB, so exposure through windows won't help. Sunscreen use. Sunscreens with high SPF can reduce UVB penetration and decrease vitamin D synthesis by 95 to 98%. Apart from synthesis in the skin, you can also obtain vitamin D from food. Since it is a fat-soluble vitamin, you'll find it in products like fatty fish, eggs, meat, and cheese, primarily animal-derived foods. As mentioned earlier, 7-dehydrocholesterol in the skin breaks down to cholecalciferol with the help of UVB. Cholecalciferol then undergoes activation in the liver and kidneys to become 1.25-dihydroxycholecalciferol, the active form of vitamin D, which acts in tissues through the vitamin D receptor, VDR. While most people associate vitamin D with healthy bones, which is true, it turns out that the VDR receptor is present in many other organs.
What?
Including the brain, thymus, thyroid gland, kidneys, stomach, small intestine, large intestine, bone marrow, lungs, muscle tissue, skin, hair follicles, testes, ovaries, uterus, and placenta. The widespread presence of the vitamin D receptor highlights its importance for the entire body. How does vitamin D affect our health? Optimizes immune system function. Proper immune system function can protect against autoimmune diseases, infections, and cancers. Studies have shown that active form of vitamin D promotes a balance of immune cells and substances critical for immune regulation. For example, it reduces the activity of Th1 cells, whose excessive presence can lead to autoimmune diseases, where the immune system attacks the body. For example, there is a study in which vitamin D was administered to individuals with newly diagnosed type 1 diabetes, a condition where the immune system attacks the pancreatic cells responsible for insulin production, leading to its deficiency and increased blood glucose levels. After 18 months, it was found that these individuals were more resistant to the autoimmune process and secreted more insulin compared to those who did not receive vitamin D. Protects against respiratory infections. Supplementing with vitamin D has been shown to protect against acute respiratory infections.
Ugh.
This effect is likely linked to vitamin D's stimulation of immune cells to produce AMPs, antimicrobial peptides, which act against bacteria, viruses, and fungi. Some studies indicate an inverse relationship between vitamin D levels and cancer occurrence. For instance, individuals with vitamin D levels of 50 nanograms per milliliter had a 60% lower risk of colorectal cancer compared to those with levels of 5 nanograms per milliliter. For breast cancer, maintaining optimal vitamin D levels could reduce the risk by 15 to 35%. Even in cases of a cancer diagnosis, appropriate levels of vitamin D might improve prognosis. Higher vitamin D levels have also been associated with a lower risk of lung cancer and longer survival rates upon diagnosis. These three cancers, colorectal, breast, and lung, are among the leading causes of cancer-related deaths worldwide. Improves fertility. Let us now move on to another aspect, Particularly significant in today's times when many people struggle with infertility. Vitamin D may have a positive impact on fertility. Here are its potential mechanisms of action. Vitamin D interacts with the hypothalamic pituitary gonadal axis, which regulates the production of sex hormones like estrogen, progesterone, and testosterone. In women, vitamin D enhances the production of estrogen and progesterone, critical for ovulation, implantation, and maintaining pregnancy. In men, vitamin D is associated with increased testosterone levels, improving sperm production and libido. You may have heard that polycystic ovary syndrome is a common cause of infertility in women. It is characterized by insulin resistance, hormonal imbalances, and poor ovulation. Vitamin D improves insulin sensitivity, thereby reducing hyperinsulinemia that exacerbates PCOS. Modulates androgen levels, which can restore menstrual regularity and ovulation. Improves your mood. As previously mentioned, vitamin D receptors are also present in the brain. Studies suggest that individuals with low levels of this vitamin and in a depressed mood may improve their well-being in a simple way, through vitamin D supplementation. The hormone responsible for well-being is serotonin, which is produced from tryptophan with the help of the enzyme tryptophan hydroxylase 2, whose synthesis is stimulated by vitamin D. This mechanism may explain why vitamin D contributes to mood improvement and can give you a little extra happiness. You can clearly see that the role of vitamin D in maintaining overall human health is very important. You can check your vitamin D levels with a simple blood test, which will help you determine whether you need to take further steps for your health. However, remember that vitamin D should not be treated as a cure-all, and excessive intake can be harmful. Overdosing may lead to elevated calcium levels in the blood calcification of various organs, including the kidneys, resulting in permanent damage. So treat it as a supplement to your comprehensive approach to maintaining good health.